Okay, next comes what are the muscles which are going to take origin and insertion into the scapula. First, we will be learning about the origin of a muscles, what muscles are taking origin from the scapula. So firstly, we take from the ventral side. From the ventral side, not all the ventral surface, scapula is having two surfaces. One is a ventral surface, another one is a dorsal surface. A dorsal surface, dorsal is also called as a back. In the back, it is having a spine. So front side there is no spine, so there is no spine here. So since there is no spine, it is a ventral surface. So from the ventral surface, not all the ventral surface, only from the medial side of the ventral surface, there is an origin of a muscle called as a subscapularis muscle. What is it? Subscapularis muscle. And the fossa, it is, this surface is somewhat a little concave in shape. Concave matlab this is a concave shape. This is a concave shape. So this side is a concave side and this side is a convex side. So this side is a concave and this is a convex. So the concave side of the ventral surface is called as a subscapularis fossa. This subscapular muscle is a multipinnate muscle. What do we mean of a multipinnate? Multipinnate means it is having a different finger like projections of the muscle. It's not arising from a single point, it is arising from different points, so it can be called as a multipinnate muscle. This is a muscle which is arising from the front surface, that is a subscapularis fossa. Coming to the muscles which are originating from the dorsal surface of the scapula. Remember, I am not discussing about the borders. Firstly, we are learning about only the surface. Surface means it does not include the border. So here we have this lateral border. Near the lateral border, we have had a pillar like large strong ridge. That ridge is acting as a pillar for the serratus anterior muscle. The serratus anterior muscle is actually a chest muscle, right? It is a chest muscle, and this serratus anterior muscle is inserted into the scapula. It's not originated from the scapula, it is only inserted into the scapula. We'll be learning it later. Now the muscles which are arising from the dorsal surface, that is a back surface. So this is a spine. The spine is dividing the dorsal surface of a scapula into two parts. That part, it is called supra. Supra means above. Supraspinous. So the muscle is also called as a supraspinous muscle or supraspinatus muscle. And the muscle which is coming from down is infraspinatus muscle. Infraspinatus muscle. Okay, now the question is, do this supraspinatus muscle and the infraspinatus muscle is coming whole from this? Yes, the supraspinatus muscle is coming all around this surface along with the upper part of the crest. Remember, this is not a 2D structure, this is a 3D structure. When this ridge, the crest or the spine, we call it as a spine, the spine is coming backside, there comes a surface along with it. On that surface, we have an origin from the supraspinatus muscle. So the supraspinatus muscle is taking its origin from the supraspinous area and along with the upper part of the spine. And the infraspinatus muscle is also taking its origin from the infraspinous area, not the lateral side. I am leaving the lateral side. See, only the medial surface. The medially it is coming, not the lateral side. So the infraspinatus muscle and the supraspinatus muscle is taking its origin from the supraspinous region of the spine and the medial part of the infraspinous region of the backside of a spine. This is what supraspinatus muscle and infraspinatus muscle is taking its origin. Now coming to this spinous area. This spinous area, what we have learned, this spinous area is also having the other projection. Projection means matlab it is coming outside posteriorly. Posteriorly, it's still protruding outside. That is called as a crest of a spine, right? From the crest of a spine, what is taking origin is a deltoid muscle. The crest of a spine, it's taking origin of a deltoid muscle. So the deltoid muscle is taking its origin from the crest of a spine. Along with it, we have an acromion process. This is a lateral border of the acromion process. So the lateral border of the acromion process is also having a deltoid origin. So here we'll get confused, either it is a medial border or a lateral border. For this, what is the function of a deltoid muscle? Always remember, a deltoid muscle is where, for suppose this is a humerus head and this will be the glenoid. The deltoid muscle will be covering whole of the shoulder joint like this. Whole of the shoulder joint like this. So in order for the deltoid muscle to cover the whole the joint like that, it should be originating from laterally or medially. If it is originating from medially, it will be going in this direction. If it is originating from laterally only, it can cover the shoulder joint like this, right? Here comes the humerus. So if it is originating from the lateral part of the acromion part only, it can cover whole the shoulder joint. Like a cup, like a saucer, it is going to cover the shoulder joint. Okay. And the next muscles which are taking origin apart from the supraspinatus, infraspinatus and the deltoid muscles are, we go to the lateral border of the scapula. From the lateral border of a scapula, there are two muscles which are going to take its origin. One will be the teres minor. Always remember, the minor will be above and the major will be below. Teres major. So major part cannot fit in this small space, so the major part should be in the base part and the minor part will be in the above. So there is a small space here. Don't look at all the space. I'm telling only about the border. These two muscles are taking its origin only from the border. From the border back side, not the front side. Only the muscle which is taking origin from the front side will be the subscapularis muscle, and that subscapularis muscle will also be along the medial side of the front part. It does not come to the back part. So these muscles will be taking its origin from the back part of the border, and it does not touch the surfaces. It does not touch the dorsal surface. It only takes its origin from the back part of the border. So upwards will be the minor and downwards will be the major. So the lower 1/3 of the lateral border of the dorsal aspect and the upper 2/3 will be the teres minor. Upper 2/3 of the border will be the teres minor, and the lower 1/3, you do not think the teres major, so it should be very very large, so it will be taking a 2/3 space. No, teres major will be taking only a 1/3 space. The teres minor will be taking a 2/3 of the border of the lateral border along the dorsal aspect. Okay, these two are those muscles which are taking its origin from the lateral border. Next comes our biceps brachii, triceps and coracobrachialis muscle. Now this is a glenoid joint. This is a glenoid joint, glenohumeral joint you call it as. Gleno is in the sense this is a glenoid cavity that we have, and this is a humerus part. This is a glenohumerus joint. So this glenohumerus joint, we take the scapula part of the glenohumeral joint. From this we have glenoid cavity. Above the glenoid cavity will be the supraglenoid tubercle we call, and below the glenoid cavity we have this infraglenoid tubercle. So the supraglenoid tubercle and the infraglenoid tubercle. So from the supraglenoid tubercle is where the biceps long head is taking its origin. Always remember, biceps brachii, we will be breaking this term, biceps brachii. Brachii means arm, the muscle which is having its action in the arm, and biceps, bi means two, and that muscle which is having two heads. So the two-headed muscle, one head will be the long head and another one head will be the short head. Now the long head is taking its origin from the supraglenoid tubercle. The short head will be taking its origin from the coracoid process. This finger-like projection is called as a coracoid process of the scapula. This is the acromion of the scapula. Right? This is an acromion of a scapula. This is a coracoid process of a scapula. So from the coracoid process of a scapula, there is an origin of a biceps. Okay. So the biceps long head is taking its origin from the supraglenoid tubercle, and the biceps short head is taking its origin from the lateral part of the coracoid process. Okay. And Coming to the triceps muscle. The triceps muscle will be taking its origin from the triceps long head I am talking about, infraglenoid tubercle. Infraglenoid tubercle. Right? It is an infraglenoid tubercle. It's taking its origin from it. How we can remember what is taking? Definitely in exam will be confusing what is having, whether the biceps is a supra or infra, or whether the triceps is supra or infra. For this, biceps, always remember, biceps will be coming in the front side of your arm. Example, take that this is a glenoid cavity and this will be the head of the humerus. The biceps should always come to the front side of the arm like this. When it have to come the front side of the arm, where do the triceps should go? Triceps should go to the back side of the arm like this. Back side of the arm. Okay. So since if the triceps is taking its origin from here, can it go to the back of the arm? No, it's not easy. If the triceps is taking its origin here, it should go like this backside. It's not easy. So the biceps is taking, it's easy for us to draw when the biceps is taking its origin from the above. Just we can draw like this. And triceps is below, so we can draw from the infraglenoid tubercle. Like that we can remember it. So the long head of a biceps and long head of a triceps is completed. Now we come to the coracobrachialis muscle. What muscle? Coracobrachialis muscle. In the name itself, it is telling that it's a coraco. It is having its origin from the coracoid process. Brachialis is something which is related to the arm. So that muscle which is taking origin from the coracoid process. The lateral part of the coracoid process is giving its origin to the short head of a biceps, and the medial part of the coracoid process is giving its origin to the long head of a biceps. The medial part of the coracobrachialis is giving its origin to the coracobrachialis muscle. Okay. So we have completed the subscapularis muscle, which is having its origin from the ventral part of the surface, and we have a supraspinatus, infraspinatus, and the deltoid, which is giving its origin, it's taking its origin from the dorsal side of the scapula, and we have a teres minor and teres major. Teres minor is having a 2/3 of the border taken, and teres major is having only 1/3 of the lateral border taken. And we have a coracobrachialis, which is taking its origin from the coracoid process, and we have a biceps, triceps taking its origin respectively from the supraglenoid tubercle and the infraglenoid tubercle. Now coming to the medial border. From the medial border, again we have two muscles called as rhomboidus major and rhomboidus minor. Again here, rhomboidus minor will be top, again opposite to the root of the spine. Rhomboidus major will be having between the root of a spine. So between the root of a spine and the inferior angle, along this all, the rhomboidus major will be taking. It's just quite opposite to the teres major and teres minor. Teres major will be having only 1/3 of the border taken, but the rhomboidus major is having a large part of this medial border taken by this rhomboid major muscle. But the similarity is the major muscles are always down, the minor muscles are always above. So the rhomboidus major muscle is this, taking all the border away from the inferior angle of a scapula to the root of a spine, and the rhomboidus major and the rhomboidus minor muscle just opposite to the spine of a scapula. Okay, this is also, we have completed all the muscles. Now comes to the insertions of the muscle. What muscles are taking its insertion into the scapula? We have two muscles which are having, one is a trapezius muscle and another one is a serratus anterior muscle. So the trapezius muscle is a back muscle which is taking its origin from the central parts of a spine, and it is going to be inserted into what? It's going to be inserted into the crest, into the spine. So the crest is giving its origin to the deltoid, and it is trapping the, so it is easy to remember. You have got trapped into the delta. Delta is something where you call it as an island. So you have trapped into a delta, into an island. You have trapped into an island. So trapped is a trapezius muscle. Island is a delta. So delta, you can call it as a deltoid. So these both are taking its, this is taking its origin and this is taking its insertion into the crest of a spine. Okay. Apart from it, we have the lateral border of the acromion taken by the deltoid. So the medial border of the acromion will be taken by the trapezius. So deltoid and the trapezius are both simultaneous going friends. So we can remember trapped into an island. Trapped is replaced by a trapezius. Island is a delta. It's also called as a deltoid. So when deltoid is taking part in its origin onto the crest of a spine and also the lateral border of this acromion process, the trapezius will be taking the medial border of the acromion process and also the crest of a spine. The next muscle is a serratus anterior. Serratus anterior will be taking its origin from the front parts of the costal surfaces, and it's going to be inserted into the scapula. So it will be having an 8 serratus anterior. In the sense anterior, it's taking its origin from the anterior part of a chest. Either it could be the costal surfaces or the radial vertebra. And serratus, we have 8 letters involved. 1, 2, 3, 4, 5, 6, 7, 8. 8 letters. So we have 8 digitations of this serratus anterior to be inserted. When the muscle is inserting in, when the serratus anterior muscle is inserting into the scapula, it will be getting inserted like an 8 digitations. The first digitation will be at a superior angle. The second digitation will be at a medial border, and 5 digitations will be at the inferior angle. Okay. The serratus anterior muscle. Anterior in the sense it is having its origin from the anterior parts of the costal area, and it is inserted into what? It is inserted into the scapula. When it is inserting serratus, you take it as an 8-letter word. 8 digitations it is requiring to get inserted. These 8 digitations are 1 digitation to the superior angle, 1 digitation to the superior angle, 1 digitation for the one digitation at the medial border, two digitations at the medial, 1 digitation at the superior angle, 2 digitations at the medial border, 2 digitations at the medial border, and 5 digitations at the inferior angle. Totally 8 digitations. This is what the muscles which are got inserted and taking its origin.